KPRC. You're watching Local 2 News at 10.
Good evening, and we thank you for joining us tonight. I'm Dominique SACHSE.
And I'm Bill Biasser. Good evening. It was a worldwide health scare. And then the worst fears surrounding swine flu sort of eased.
But now some local health experts are questioning whether we really know the extent of the infection. You see, there is a huge testing backlog going on in Houston, so we don't really know how many cases we've got. KPRC Local 2 reporter Elizabeth Scarborough live in the Texas Medical Center tonight. Elizabeth, we're talking about thousands of cases that still need to be tested, right?
That's right, and starting tomorrow, there will actually be lab workers here around the clock trying to get through that massive backlog.
I don't know. We just don't know.
Dr. Uthman says we don't know how many people around us actually have had swine flu. He's a pathologist testing samples of flu.
Then the question immediately comes up, is this the H1N1?
For that, the specimens are sent here to the City of Houston Health Lab. The problem? This doctor says he's been waiting and waiting for answers.
It's been more than 10 days. Still, we have no results.
Let's break it down. The City Health Department tells us they've received more than 6,300 specimens from 17 counties. Of those, about 2,300 were tested, and 52 came back from the CDC positive for swine flu. By our calculations, just over 4,000 specimens are still sitting there waiting to be tested. That's quite a backlog, enough for the City Health Department to add a third shift of lab workers starting tomorrow to get through it.
Yes, there is a backlog, but we have prioritized the specimens that we have received based upon the symptomology of the patient. People who had no symptoms but submitted a specimen, they're going to be tested much later.
Working around the clock, spokesperson Kathy Barton says they should catch up in a few weeks.
We have always said to physicians, if you suspect your patient has influenza, then treat them as if they have influenza. Do not wait on us for the diagnosis.
But Dr. Uthman says we can't get an accurate picture of how widespread the problem is until the tests are done.
The only way that we know that a case is confirmed is if the test has been run on it. So if the test hasn't been run, it doesn't show up as a confirmed case or a non-confirmed case.
And keep in mind, they are still getting new specimens in just about every day at this point. We're live in the Medical Center. Elizabeth Scarborough, KPRC, Local 2.
Now, Elizabeth, I understand that the city does not have to send samples to the CDC anymore for confirmation.
That's right. Actually, they do not have to go through that extra step anymore. They're able to do all of the testing right here, and that means that it could hopefully shorten that waiting time quite a bit.
Okay, hopefully so. Meantime, there have been more than 2,600 confirmed cases of swine flu in the U.S. and 3 deaths reported.